Hey, so picture this. You go on a cardiac arrest. A few things you need to do is attach a patient to the monitor. The quickest thing is to get a quick look. You can get electricity in faster. So you want to put the CombiPads on the patient. What position do you use? Do you follow the instructions that are on the outside of the package? That pad placement positioning is either called sternal apical, or most of us think about it as anterior-lateral. You have an anterior placement on the sternum, and you have a lateral placement over on the lateral lower rib cage. The concept behind defibrillation is to deliver a shock between those two pads, and the heart between that is taking some of that electricity and resetting itself. One of the alternative pad placements is to go anterior-posterior. So for anterior-posterior, I'd have one pad on the front, just to the right of the sternum, and I'd have another pad on the back, just to the left of the spinal column. And in that case, to me, it just seems more likely that the heart is between those two pads as compared to anterior-lateral. What does the science actually say is our best option? What's the science say is our best choice for this? 2024 article published in the Journal of the American Medical Association by Lupton looked at 225 patients of out-of-hospital cardiac arrest in a shockable rhythm. There was a 2.64-fold greater odds of ROSC in the anterior-posterior placement compared to sternal apical. In 2022, Resuscitation had an article by Steinberg that showed no difference after a trial in Houston looking at the two different placements. The science isn't especially clear. Looking at it logically, it seems to me that anterior-posterior makes a little bit more sense. So why do we have the anterior-lateral pad placement? The reason, I think, is this. These are the paddles that I first used when I first started in EMS. For those that don't know, for those that are too young, we used to put conductive gel on these, kind of rub them together, and then be able to press them with about 20 pounds of pressure, and then you're using your thumbs to charge and dial and fire the electricity, the defibrillation current into the patient's chest. Now, obviously, during a cardiac arrest, you can't sit the patient up and just kind of squeeze the front and backside of their chest like with a big hug. So I think that's where the anterior-lateral or the sternal apical placement came from. I think it makes a lot more sense now that we're using CombiPads to go with the anterior-posterior. So for the last year or two, that's what I've been doing. That's what I've been trying. And for me, anecdotally, I've been having good results with it. I've been having good results in a grantedly small anecdotal self-performed study, an informal study that I've been having good luck with it. I think it's a good thing, and I think it's something that we should try. I think the anterior-lateral placement is a relic of old equipment. The other thing that I will say associated with this is that other things matter probably a little bit more. Early defibrillation, good CPR, matter a lot more than pad placement. What we want to do is deliver the electricity as quickly as possible, in the right time, in the right amount, and all of those things. That's what's most important. So if it's difficult to roll a patient, or if it's difficult to manipulate a patient, don't worry about it. Get electricity into that heart if that heart needs electricity. I think this is a difficult thing to study very well, to get very large numbers, and to change our practice. I do think that there's maybe some signal kind of hidden in some of this science. This is not a definitive answer, but what I would say is consider an alternative pad placement. If you know of any other journal articles or any other kind of definitive answer, make sure and speak up. I don't think it's out there. What are you doing in your practice? You know all the YouTube stuff. This is Angry Bill for Pre-Hospital Wisdom. Make sure to like, subscribe, share, talk about it, comment it, click another video. I appreciate you. Thank you very much for the support you give me. Until next time, stay safe.